Good afternoon. I'm Dr. Jas Atwal, Acting Deputy Chief Provincial Public Health Officer for the Province of Manitoba. I'm joined today by Dr. Josh Reimer, Medical Officer Health and Medical Lead for Manitoba's COVID-19 Vaccine Implementation Task Force. Today we are announcing one additional death due to COVID-19, and this is from the Southern Health Centre Sud Health Region. I want to extend my condolences to the families, friends, and caregivers of these individuals announced today. The current 5-day COVID-19 test positivity rate in the province is 3.9%, and in Winnipeg, it is 3.3%. As of 9:30 a.m. today, 64 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 31,721. Yesterday, Dr. Roussin was here, and he announced proposed public health order changes that are under consideration for the entire province. They can be viewed online at manitoba.ca. A reminder that these may not all be made at once, but will be used to guide orders in the weeks ahead. Not everything can be opened up at the same time, and large gatherings of people for long periods of time present the greatest risk for COVID-19 transmission. It is important to note that these changes would keep the province under level red or critical on an ongoing basis. All changes also include requirements to continue to follow the fundamentals, like appropriate physical distancing and mask wearing. These changes will be considered for implementation in 2 phases over a 6-week period based on public feedback. They could go into effect as early as March 5, and then again for a second iteration on March 26. As with previous orders, Manitobans are asked to provide their feedback on these latest proposed changes, with particular focus on deciding which services are the most important to reopen at this point while continuing to balance public safety. To provide feedback, please visit engagemb.ca. The feedback received will be used to guide changes in the weeks ahead, though all these changes may not be made all at once. We're able to consider these changes because you and the hard work and diligence of Manitobans. While it is hard, it is paying off. However, with the variant of concern now here in Manitoba, it is crucial that Manitobans continue to follow the fundamentals of washing our hands, covering our cough, physical distancing, wearing a mask, staying home when you're safe, getting tested. These are all the things we need to do to keep our numbers trending down and maintaining our numbers in a minimal manner. We need to continue to avoid activities that are known to cause the greatest risks, such as crowded places, closed spaces, and close contact settings. This will help contain the spread of COVID-19 until we can immunize more and better protect our population. We continue to be cautious in our approach. We don't want to open things, close things, and then reopen again. We want a nice, steady, gradual reopening over the next few months' time. Manitobans' adherence to the orders and the fundamentals will determine our next steps and our ability as Manitobans to get back to those things that we love. Thank you, and I will now turn it over to Dr. Reimer.
Thank you, Dr. Atwal. Good afternoon, everyone. I'm Dr. Josh Reimer, Medical Lead for the Vaccine Implementation Task Force. Today, Health Canada announced it has approved the AstraZeneca vaccine for use in Canada. I wanted to be here today to join Dr. Atwal to let you know what we know so far, to answer questions, and also to let Manitobans know that we will continue to update them as information becomes available. The approval of AstraZeneca is an important next step in our vaccine campaign because it is much easier to ship and to store as compared to the vaccines that we are currently using. It can be stored in a fridge, for example, and doesn't require the low temperature freezers that the other vaccines do. This will make it possible for people to be immunized in their doctor's offices and in pharmacies, in a familiar setting, if that's where they choose to do so. Manitoba has been planning for this, and right now we already have 250 clinics and pharmacies that have gone through all of our processes to be ready to go when the vaccine gets here. And we've had total about 500 of those clinics and pharmacies who have expressed interest, and they are now in various stages of either the approval process or the logistics of becoming ready. We encourage physicians and pharmacies who are interested and have not yet signed up to go to manitoba.ca/vaccine where you can get some more information about how to register. And while this is all great news, the vaccine is not here yet. We're waiting for more information from Health Canada about how many doses we will be receiving and when we can expect them. In the meantime, we are finalizing the eligibility criteria for this vaccine, but this will be based on our analysis of the recommendations from the National Advisory Committee on Immunization, which has not yet been released. So we are looking forward to seeing what the National Advisory Committee on Immunization puts forward as their recommendations for the use of this vaccine. And even more than that, we are looking forward to working with physicians and pharmacists to get needles into arms as quickly as we can. And I expect we'll have more details on this next week. So we will now open up to questions.
Thank you, doctors. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CBC Manitoba, Bart.
Hey, Dr. Reimer, how are you doing? If pharmacists are to be giving out the AZ vaccine, how come they are not eligible to get their shot right now?
So pharmacists, pharmacies in general that have signed up to provide the vaccine, once we have the vaccine here and our program is finalized, they will be considered designated COVID-19 vaccination clinics. So they'll be eligible in the same way as other designated clinics currently are.
Okay. 2 days ago, when you announced the general population coming in for the vaccine, I had asked about what your plans are for people who cannot leave their home. Now, I see other media have asked that question again. The response so far is to just do what you normally do and get relatives or caregivers to take you. Obviously, that's untenable, and Manitoba actually has a obligation under Human Rights Act to ensure medical treatment for everybody. So what is the plan, either involving mobile teams or paying for stretcher services, to get people who cannot leave their homes vaccinated?
Yeah, that's a great question, and one that our operations team is looking at all the time. Our intent right now was to ensure that our super sites were available and were ready to receive people who were elderly and may have additional needs compared to the healthcare workers who had been going to those sites so far. And we're exploring a lot of different options. We're working with some community organizations around transportation options. And as we get more information about the stability of vaccines, as well as information about what NACI is recommending for AstraZeneca, that will allow us to plan further about how far we can push these vaccines. The information right now about the mRNA vaccines doesn't allow us to take it door to door, but depending on what happens with those vaccines and the data that develops over the future, that could change. And likewise, it depends on what the National Advisory Committee on Immunization says for eligibility criteria, because this vaccine would be more flexible for doing something like a door-to-door campaign. So we are working on it, and we're waiting on information to help us guide our next steps.
Thanks for that.
From the Canadian Press, Kelly.
Hello. Do you have any indication on numbers or expected numbers for AstraZeneca?
The federal government has not released any allocation numbers yet, but I expect that we'll be seeing that next week.
And what could this mean for the general population's access, or even based on the current ramp up of the two other vaccines? Is there any idea of when the age requirements might drop down?
So for the mRNA vaccine, so for Pfizer and Moderna, we are continually reviewing how many appointments we have open and how many phone calls we're getting through our booking system. And we decrease the age of eligibility as we see that those appointments remain open. So we have already decreased it to 94 and 74 for First Nations individuals. And our team is going to continue to look at that every day. With the intent, right now, our estimate would be that we next week will be able to reach people who are over 90.
From CTV Winnipeg, Michael.
Yes, hi, Dr. Reimer. I know we're still waiting on allocation information details, but I'm wondering, just given that, the feds have already said they'll be getting about 20 million doses of the AstraZeneca vaccine by the second quarter, how much does this move up Manitoba's timeline in terms of its vaccination rollout? Are we, essentially, does this approval mean that we're moving closer to that end of August deadline where most of the province may be vaccinated?
Yeah, this is great news for our timeline and really does push us closer to our high supply scenario planning. We haven't received any information yet from the federal government about what Manitoba will be receiving from the allocations. And we just literally an hour ago got off the phone with them about some of the general information that they have regarding this approval. So we don't have the exact timeline worked out yet. But as soon as we find out what Manitoba can be expecting, we will be adjusting our timelines and letting Manitobans know. But certainly, this is only good news as far as how long it will take to reach all Manitobans, because the more options that we have and the more convenient it is for people to receive a vaccine, the more Manitobans will be able to receive it before the end of summer.
Wonderful, thank you. And this is more for Dr. Atwal, but on the proposed changes, one of the proposed changes for restaurants to open at 50% capacity, but still having the requirement that individuals only sit with members from their same household. So just wondering what the rationale is there on why increase capacity, but not allowing individuals to eat with folks who they may not live with.
Yeah, so we wanted restaurants, we wanted business to be able to be open. Manitobans wanted to get out and do some other things, and through the responses that we got through Engage MB, restaurants was one of those things. We also need to limit risk, so we needed to just keep it at the household level, because we know people come to restaurants, they come together with other households, which does increase risks. We really want to mitigate risk of spread of COVID-19, so it's that indoor place where someone is prolonged, potentially sitting across from someone with COVID, that really does increase that risk to that person. So, these measures are in place. We're always going to be taking a look at these measures and looking at what the next set of orders might bring. But for the interim, we do want to limit our cases. We know once we open up a little bit more, we all are going to generate more cases. And we want to generate cases in a way that our system can manage it. From a public health standpoint, we want to be able to manage it, but also from the acute care side. So every case we generate has an impact on how many people get hospitalized. So we have to balance that. So by pushing it up to 50%, it still allows more families to go out together, to go out to eat, allows the businesses to adjust to a higher volume within that facility and see how that operationalizes. As an example, recently we heard stories where 5 people from 5 different households tried to go sit at a restaurant together. That poses risk. All the messaging that's out there, why did these 5 people choose to go together to go to a restaurant? And the owner and the operator of that restaurant, checked and validated information, and they set them all at different tables. We want to avoid those things because that poses risk. So those orders are going to be, household only. And again, this isn't forever. This is an interim measure, and we'll readjust things as time goes on.
From City News, Jonas.
Good afternoon, folks. Dr. Atwal, first question for you actually is following up on a report from BART this morning on CBC on an alleged assault of a pandemic enforcement officer. Just wondering if you have any information on this and if you're aware of any direction or any change to enforcement.
Yeah, I'm not aware of the details of it. I believe the matter is under investigation, and I don't have the details at the time. We know that enforcement officers are working to enforce public health orders, which are in place to protect everyone. I think Manitobans need to respect these individuals as well. So any behavior that is untoward to an enforcement officer can constitute harassment or assault, and that is a serious offense. And I think the enforcement side will be managing it in that manner as well. And anything specific on the enforcement side can be directed to enforcement as well.
I appreciate that, sir. Dr. Reimer, one for folks that maybe have been a little bit disappointed in the initial rollout of the vaccine or thought it was slow. Maybe just a general statement on what folks can expect moving forward and is it more stable? And just kind of, I guess, where we are right now with our.
Yeah, so our system is in a great place right now. We have capacity to provide over 10,000 doses of vaccine every day if we had those doses available. So, you know, we didn't stop working when we had the disruption with Pfizer nor the disruption with Moderna. We worked really hard to continue to expand our capacity so that we would be ready. And when more doses came, that we would be able to very quickly ramp up those clinics and provide those doses to Manitobans. So we're certainly hearing estimates from the federal government that we expect to see the number of doses going up substantially in Q2. And I would say, you know, everyone on the team right now is feeling anxious to get going. So as soon as we have those doses, we want to roll it out as quickly as possible. And likewise with AstraZeneca. We have 250 clinics and pharmacies that are ready to go. So when we have those doses here in Manitoba, we're going to ship it to those facilities as quickly as possible so that they can start reaching out to Manitobans and providing eligible Manitobans with that vaccine in a more convenient location. So I think we're in a great spot from our perspective, but we need to be cautious also because vaccine supply is always unpredictable. Even outside of a pandemic, vaccine supplies are unpredictable. And I think we need to expect that we'll see more supply disruptions at some point. And so our system is trying to plan to have multiple mechanisms to reach Manitobans that can be flexible depending on which vaccine we have available at what time.
From the Winnipeg Free Press, Dylan.
Good afternoon, and thanks to both of you for taking our questions. Dr. Reimer, I'm just looking if you can provide an update about the online booking system. We seem to be behind other small provinces, and the feds tell us that there's a massive amount of doses coming. I'm just wondering if you have any timeline for when an online booking system will roll out, and what exactly is causing the delay?
The online booking system right now is being piloted with a small group of eligible Manitobans. And so they're trying to work through any of the challenges that happen with any new system with that smaller group before we open it up to the general public and stress it by having many more people involved in the booking. So we'll have an update hopefully next week. I'll be able to provide more information about the plans for that booking system. But I do know that they are still completing the pilot as we speak.
Thank you. And Dr. Atwal, I'm just wondering about the timeline for getting samples of suspected variants from CADM lab over to the National Microbiology Lab. Do you have a timeline for how long it takes to get those samples to NML? And have you been able to determine what had caused the 13-day delay in getting the sample from the first variant case down the road to NML?
Yeah, so basically our provincial lab is screening all of the positive COVID cases or COVID test results for the variant. So they have that capacity to do once the test result is returned as a COVID positive within 24 to 48 hours. Thereafterwards, I believe it's a quick transition to the NML lab. So again, within a 24-hour period. So once something is sequenced positive, once something is screened positive from CPL, it gets sent over to the NML lab for sequencing. I think that happens within a 24-hour period. The sequencing does take a few days to get done, and so the final result takes several days to get back from NML. I don't think there's any delays in the process right now. I think early on there may have been a bit of a delay on the first screen positive and getting that to NML for various reasons. I think that was addressed a couple of weeks ago when we spoke about it. I just don't remember the details of it.
From Global News, Marnie.
Good afternoon. My first question is for Dr. Reimer in regards to AstraZeneca. It appears to have a bit of a longer time interval between first and second doses. Given that, would the province reassess the idea of delaying second doses and instead prioritizing first doses?
Yeah, so the AstraZeneca trial was really multiple smaller trials that occurred in multiple countries at the same time. And in some of those trials, they delayed the second dose up to 12 weeks and actually found that it was more effective when the second dose happened at the 12-week period compared to when it happened earlier. This is one of the complicating factors that has made it more difficult for Health Canada to approve because the data has been more complicated from AstraZeneca. But that certainly was encouraging to see that not only was it not harmful, but it actually was beneficial to wait longer for that second dose and see that effectiveness go up. As far as delaying the first dose more broadly in Manitoba, that is something that we have been looking at since the beginning. And when we started our campaign, there really wasn't any data to tell us whether or not it would be safe and effective to leave the manufacturer's guidelines and go that direction. As trials are being completed and as information is shared, we will be analyzing that and making decisions about whether we continue with the current process of ensuring the second dose happens in 3 to 4 weeks, or if we might move towards waiting on that second dose in order to get more first doses to Manitobans. So, we've always been watching the science and making sure that we're flexible and we can respond when we know that it is safe to do so.
Thank you for that. And my next question is for Dr. Atwal. We're hearing some concern or frustrations from maybe smaller communities that they're still in level red restrictions. For example, Prairie Mountain Health Region having lower numbers. Just given that we have this color-coded response system, why not ease back restrictions in places that have had lower numbers for a while?
Yeah, so, we are looking at easing restrictions right across the entire province. I think in the past we've, had those experiences where if one region was treated a little differently than the other, there was a lot of movement of individuals across that border, right? And it's really a invisible border. So, if one region had different set of restrictions and lesser restrictions than another, we saw hundreds or thousands of people moving from one area to another, which poses risk. So the intent here is to look at the province as a whole. We have those measures in place, those, provincial border measures related to travel, which is protecting Manitobans. So we wanted to look at mitigating risk for the entire province. So our focus is going to be on that, and we're going to continue to focus to look at the province as a whole.
From the Brandon Sun, Michelle.
Good afternoon. My questions are for Dr. Reimer today. In BC, the Métis are eligible to get their vaccination starting 15 years younger than the rest of the population. Alberta is taking similar action. The Métis Nation in Saskatchewan is also working with that provincial government. What is the rationale for Manitoba not engaging with Métis in similar ways when the conditions, vulnerabilities, disproportionate affect, etc., in the Métis population are the same and, if not worse, than First Nations?
So our initial decisions were based on the epidemiology and the data that we had in front of us. The data was very clear that our First Nations, the First Nations people in Manitoba were experiencing worse health outcomes and at younger ages. And so we worked with First Nations health experts to ensure that equitable access was provided to those communities based on what we saw in the data. We don't have the same access to data when it comes to the Métis population in Manitoba, but we are working with them. They've been participating on our urban Indigenous planning table, and I know that that Minister Stephenson and Minister Chartrand have had some conversations as well, and we'll continue to work with them going forward to determine best steps for the Métis people in Manitoba and for all Manitobans.
Second question, will you be considering that age group difference for the Métis?
I would say nothing is off the table. If we have data to demonstrate that something is essential to provide the best possible care for Manitobans, then we absolutely move in that direction. Right now, we don't have that data to depend on, but that's something that we are trying to work on together, and we are always open to changing processes to respond to the information that we have.
From CJOB, Clay.
Good afternoon. All my questions actually have already been asked. So I'll just continue to listen. Thanks.
Thank you. From the Winnipeg Sun, Glenn.
Yes, Dawkins, the Winnipeg Sun. Question for Dr. Reimer. It's kind of a two-part question. With the AstraZeneca vaccine, would this be similar, the administration of it, would it be similar to how people go to their local pharmacy for their annual flu shot? And just a kind of a general comment from you on this development of its approval by Health Canada.
Yeah, so that's a great analogy. It will be similar to when people go for their annual flu shot. So we got clear feedback from the pharmacists and physicians that they wanted to be booking their own clinics and have control over those schedules. So we're talking with them about how they can best reach out to Manitobans who are eligible, but likewise that Manitobans can reach out to their own physician or their local pharmacy to book an appointment depending on how many doses are available. So we wanted to have this option to make things as convenient as possible for Manitobans. And so my broader statement about AstraZeneca is that this is great news. We want more options and we want more doses for Manitobans. The sooner that we can get a dose into every eligible Manitoban, the better off we all are as a community. Once we start to get to higher numbers, we start to protect each other, because if one of us can't carry the virus, we can't give it to anybody else either. So having multiple tools within the immunization rollout just makes it that much easier for us to reach everyone in Manitoba who's interested in getting a vaccine.
My follow-up is, according to the vaccine bulletin that came out today, anticipation of greater vaccine supply in April has posted a request for service agreements for organizations to provide the focused immunization teams. Can you talk a little more about what that will entail, and are we talking about going into other than different congregate living facilities, or what exactly will that entail?
Yeah, I think I actually have to take that question away. I'm not involved in the contract negotiation side of things. We really try very hard to keep the scientific and clinical side separate from any of the financial or contract side of these decisions. So we can take that question away and have somebody who works more on the operations side provide a response.
Our final reporter this afternoon from CBC Radio Canada, Mohammed.
Hello, my question, I guess, is for Dr. Reimer. I was wondering, there's some concerns about the AstraZeneca vaccine in Europe. Some countries are saying that it should not be administered to people over 65. What are your feelings about that?
Yeah, right now we're waiting. The National Advisory Committee on Immunization has not yet released recommendations on who we should be offering this vaccine to. Certainly some countries have expanded it to all ages. In the UK, they're using it for all ages. But we know other countries in Europe have decided to limit it at age 65. So Manitoba is going to look at the recommendations from NACI and use those to help inform our final decisions about which Manitobans we offer it to. If it ends up being that we stick to a younger age cohort, then we'll have to make some decisions about who is highest risk in the younger age cohort to be able to ensure that we are protecting Manitobans as quickly as possible and protecting our healthcare system. So making sure that we're providing the vaccine to those people most likely to end up in the hospital. So I don't have a definite answer yet about who is going to be eligible for the vaccine because we're still waiting on the national guideline. But we're hopeful that we'll be getting that next week and can provide more detailed response for Manitobans then.
Thank you very much, and I have no follow-up today.
Well, thank you, everyone. This concludes our media briefing.